Hi guys, meet me again in my channel, and today I want to let you know about one among the detoxification procedure, in which this is also come under the fifth variety of the panchakarma, which having the important role in the management of the ENT, or in short it is a brain disease. Let's see what the Acharya said. It is said that aushadam nasyam snehoa nasikabhyam diyate iti nasya. Administration of the medicine drug or medicated oil through the nose, it is called as nasya. Whatever the panchakarma that we are undergo have the specific aim, that is remove the dosha through the easiest or nearest route. So for the treatment for any disease of the head, the physician should administer the nasya therapy. It is said that duaramhi siraso nasya tenatat vyapyahantitan, because the nose is the gateway of the head. So in which form nasya can be done? Nasya can be done in the form of the oil or taila, or in the form of the churna or powder, or else it is in the form of the extracted juice from the kalka. Okay, the general dravya which can be used for the nasya, it is the like apamarga, pipali, maricha, sigru, ela, haritaki, tulasi, jyotismati, and other drug also can be used for the nasya. Okay, based on the quantity of the medication of the nasya can be classified into two, that is marsha nasya and pratimarsha nasya. What is the difference between marsha nasya and pratimarsha nasya? If it is age, the marsha nasya, it can be done from the 12 to 70 years old, but for the pratimarsha there is no restricted of the age, from the birth to death it can be done. And for the effect, the marsha it is ashukari or immediate effect we can feel, but for pratimarsha it is delayed or chirakari effect. For the benefit for sure will be more in the marsha nasya, but in the pratimarsha the benefit will be less. And the dose of the marsha nasya we can give the 6, 8 and 10 bindu or drop we can say, but in the pratimarsha it is 2 drop. In the marsha nasya there is restricted patya that we should follow, but in the pratimarsha there is no any restricted the patya that we can follow. And for the marsha nasya there is a more chance for the getting complication, but in the pratimarsha there we should not fear, because there will be no any complication can be happen. Okay, so my recommendation is, if you want to do in the daily basis, we can go to the pratimarsha nasya, because it will be giving the same effect as marsha nasya, as like what Wagbata said. What the Wagbata said about the benefit of the pratimarsha, it is said that ajanma maranam sastaha pratimarshastu bastiwat marsha wacha gunan kuryatsa hi nitya upashewanat na chaatra yantranam na api vyapat bayo marshawat bayam. So what is the meaning? The pratimarsha nasya, it is good from the birth to death. It's just like the enema therapy, and it will be giving the same effect of the marsha nasya if we are using in the daily basis, and there is no restricted, there is no regimen that should be followed, and we should not fear about the complication also. Okay, now I want to let you know how the process of the marsha nasya should be done. As like other treatment of the panchakarma, there will be purva karma, pradana karma and paschat karma, right? In purva karma, the selection of the patient should be done. Then we have to prepare and make ready the medication, which one is ready for the nasya for that particular person, and we have to keep ready for the oil for the abhyanga, and we going to do the swedana also. So we have to keep ready the nadi sweda, and we have to make ready warm water or salt warm water. In the end we are going to do kavala, and duma yantra or duma varti should be there. For preparation of the patient after evacuation of the natural urges like urine or feces, and the patient have to advise to wash their face and gargling their mouth, and he should be given the abhyanga and swedana over the face, and the patient is advised to lie straight in the supine position, which is arm and leg extended in the cot. And the leg should be slightly raised, the head should be slightly raised to 45 degree, like that. Okay, now coming to the pradana karma, after purva karma finish, now how the medicament should be given, right? The medicament should be given with the left hand touching the tip of the patient nose, and it is little bit extended down like this, and with the right hand we just gently instill the both nostril. During this procedure, the patient have to be relaxed before and after procedure is happening, and the patient has to avoid the speech, anger or laughing or excessive moving of the head. Okay, so during this time. Coming to the paschat karma, after all this procedure, at least we have to asking to the patient to have a rest, at least 5-minute rest in supine position. Then after that we have to give a slight massage to the forehead, ear, cheeks, shoulder, and then patient have to inhale moderately the medicament which is in the nose. So after that they will be feel like something disturbing in the throat. That should be split out. That's why we have to keep ready the kidney tray or any bowel, so the patient can be easily split out in that, because that mucus should not be swallowed, right? After that, we can give the kawala. Kawala is like warm water we keep ready with the salt you mixing and asking her to gargling, so it will be give the clear effect also for their throat. So after that, we can advise the patient to do the Dhumapana. Actually, Dhumapana is not much necessary. You can do, or you can also not doing if you don't want. But if you want, so ask the patient to sit comfortably with the eyes straight, with the mind of the steady. So the Dhumapana, it is the inhalation of the medicated drug, right? Fumigation. So what we have to do is we have to inhale through one nostril while keeping the other nostril is closed. So inhale through the nose. Then after that, we have to exhale out from the mouth. So this is have to be repeated 3 times from the right and left nostril, and also we have to do in the mouth also, while inhale through the mouth and exhale out through the mouth. And this is to be followed, because if we are do exhalation from the upward movement, it can be harming that eyes. That's why there is a restricted to do for the Dhumapana, that the age from the 12 to 70 years old. So this is all the procedure of the Marsha Nasya. Now we are going to the contraindication and indication. Okay, coming for the indication of this therapy. Actually, it can be given in the Sira Roga or Adawa Bedaka, we can say it, or we can say it's migraine, and we can give in the Netra Roga also, or like Aksi Raja or congestion of the eye, and it can be done for the person who have the Danta Roga like toothache or sensitivity of the teeth. And actually this treatment, or generally the Nasya, it is the treatment which is very useful for the disorder above the clavicle. If you have any problem above the clavicle, it is very good for going to the Nasya therapy. So what is the contraindication of this treatment? You should not done soon after you have had bath, because it will be cause the pratishaya or running nose, and you should not do also when you have the Nawajwara, because the heat will be spreading out to the eyes and it will be cause the cataract or timira, and it will be cause the jwara also. And you should not done when you have ajirna or indigestion, or soon after you have food, because it will be obstructed the Urdhva Vahasrotas, which is led to the to cause the breathing difficulty, cough, running nose, and vomiting also can be happen. So this should be take care. So what is the action, or what is the mode of the action of this therapy actually? So actually the nose is having the highly blood supply which is connecting to the brain through the blood-brain barrier. Through past the blood-brain barrier, only specific chemical can be enter, like the small molecules or fat-soluble molecules or specific gases can be entered through the blood-brain barrier. And usually that what we are using for the Nasya, it is the medicament in the form of the oil or in the grata, which is in the fat-soluble molecules. So while instilling the Nasya, it can be directly go to the target, right? So okay guys, that's all about the Nasya therapy, and in the short, I want to let you know the advantages of the Nasya therapy, which is rapid drug absorption, its quick onset of the action, better nasal bioavailability of the small molecule drug, and the drug which cannot be absorbed through the orally, it can be done with the systemic circulation through the nasal therapy. And I want to let you know the few thaila which we are using in the disorder, like in the Adawa Bedaka or Pakshagata, a paralyzed patient, we are giving the Nasya with the Anu thaila or Danwantari thaila or Shirabala thaila also can be done. And in the Shirashula, Shirabala thaila, Anu thaila or Sadbindu thaila also can be done. In this Pinasa, Sadbindu thaila or Anu thaila also we can use for the Nasya therapy, right? So guys, before you did the Nasya, it's better to take the appointment from your Ayurvedic doctor, so you will be getting the best treatment. Thank you so much for watching. I hope what I share, it will be useful for you. Don't forget to subscribe my channel, and if you have any doubt or any inquiry, please leave in the comment section. I will try to solve your problem as much as I can, and if I cannot also, I will be asking my friends who are knowing better than me. Thank you so much for your love. Thank you so much. Thank you so much. I love you. Stay healthy. Mwah.